Hi everyone, my name is Dr. Loria. Today's subject is about penile pumps. Now there's a big mystery about penile pumps, meaning that some people say, hey, does it work? Doesn't work? How do you work with this thing? And what is the objective with a penile pump? Okay, a penile pump is to do two things. One, it's there to help you get an erection. Right, there are prescriptions actually for prescription type pumps that you put on for about a minute. Basically, you put it onto the penile shaft, and it's a tube. You slide down, right? It's a tube. I'll draw the tube here, but those who are listening will get the idea. There's a tube. There's a little connector tube to a device that pulls the air out of the tube. So imagine putting this cylinder or tube on the penile shaft. You have a device that actually sucks the air out. It's a little like a hand pump thing. And all of a sudden you have negative pressure in the tube. Now what happens to tissue, or in this case the penile shaft and glands, what happens to it when it's in touch with or within a negative pressure chamber? What happens is there's fluid that's going to come in. Now there'll be blood coming in through the vasculature, coming into the penile shaft, but also there'll be ultimately a little edema as well. Okay? But the objective, talking about helping getting an erection, is to use the pump to bring the blood in, right? And let's say it takes about a minute, possibly two. Then when the blood is in and you have like an erect penis, then what you do is take the pump off and put a rubber ring at the base to constrict, to prevent the blood from leaving. Okay? This helps some men in maintaining an erection and having the ability to have intercourse, because when you have erectile dysfunction, there's blood flow issues, right? And that's what this pump is good for. Now, another thing it's good for, and let's talk about not those young men or men who do not have erectile dysfunction, they might want to use the pump to get larger. Now, not just erect large, but larger and beyond the erect size, okay? Now, what happens in that case? If you were to put this tube on, okay, so of course we're going to draw the simple tube, but you can imagine and see this tube being placed on the penile area. And you might want to use a little Vaseline at the base to form a seal, right? Because the bottom of the tube is open-ended, right? So you slide the penis in it. It's going to be sitting on your pubic area and scrotal skin. So you want to use a little Vaseline to get a seal to it. Otherwise, it becomes a nuisance to try to get negative pressures to go up, because there'll be air leaks underneath, right? All right, so I have this tube on, right? This penile tubular structure. You have this hand pump that you're pumping and you're pulling air out of it, causing an increase in negative pressure. Now, what I tell my patients, there's some certain scenarios that I want them to use the pump, okay? But I instruct my patients to be very careful. You use low pressure to start. You might start out with 5 minutes of pump time, and then you increase that slowly, okay? And I'll tell you why I have my patients use it occasionally. But for you guys out there that just want to get larger temporarily and see how it feels, right? What you do is you buy one of these pumps. It has a little hand pump to it. Try this. You could put it on, all right? Use a little Vaseline to seal. Gently pump it up to maybe, 3 millimeters of mercury or something like that. Something light for 5 minutes. And then maybe a couple days later, go to 3 again, but maybe go to 10 minutes in length of the time that you're using the negative pressure here, and increase slowly. So by the time 2 or 3 weeks passes, you'll probably get up to about 7 millimeters of mercury, and possibly around 45 minutes of pump time. Now, if you let your penis sit in this tube for 45 minutes at 7 millimeters of mercury pressure, just 7 on the dial, you'll see a dial, just go to 7. What happens is water starts coming in, edema. If any of you have sprained your ankle or your wrist, you see how much it blows up? Well, that's the same reaction. Okay, that's more rapid. It's a little different. Here, it's a predictable type of reaction. It's controlled, and you do it slowly. We're not damaging tissue here. With a sprained ankle, you damage tissue, and swelling comes in rapidly. That's not what we're talking about, but it's a similar reaction where you can see how big something can get, right? Here, it's a control reaction. So the penis is in the tube. Little by little, it expands and expands and expands. You wouldn't believe how much it can expand, okay? We're talking like, for example, if you have an erect girth of 5 inches, for example, you could actually expand it to 7 or even 8 inches in girth. Okay, that might sound great, and it helps a lot of guys. However, there's a drawback. First drawback is the erections are not super firm, right? Because it's water. It's like a bag of water. So you'll have better intercourse, right, being bigger, but it'll be a little squishy, right? And sometimes the size outweighs that effect. Okay, you don't have to necessarily get it to 8 inches. You can get it to, if you're 5 inches in girth, you want to get it to 6. That'll be a little better regarding firmness and so forth. So why do we use a pump? We use it to get an erection for those who have erectile dysfunction. We'll use a pump for just getting bigger, right, for your partner. I know a lot of patients who, for example, they'll use the pump on almost a daily basis and not even tell their partner what their real size is because they don't even know, right? They keep it a secret. And that's kind of a tough situation because now you got to keep up with that and so forth. And that's okay if you're willing to do that. But we were talking about permanent fillers in one of my talks. And if you want to be large all the time, you go for a permanent filler, right? I say you're Johnny on the spot. You can just have intercourse, not worry about going into the bathroom for an hour to pump while your spouse or partner's waiting. Okay, so there you have those 2 reasons to use a pump. Now, a third reason is for patients who come to me, we have a filler treatment, right? We put filler in, they get bigger, but their skin is tight, right? They make such dense collagen, which is a good problem to have because they'll have a firm erection until they're 110 years old. So they have this firm collagen formation, which is great, but on the subsequent treatment, if I try to put filler in there, it's so much tension, I can't put a lot of filler. So what we use is a penis pump. The penis pump helps us stretch out that dense collagen, right, that stiff, dense collagen. And when patients come in on a subsequent treatment, a second or third treatment, we could really load it up. And then they form that good collagen again, and they have phenomenal erections. So it's nice to have that problem where you're forming super dense collagen, where you have to use a penis pump to help stretch it out. Okay, all it does is delay the sequence of procedures where if, let's say, you do a procedure today, 30 days later, technically you could do a second treatment. However, if your collagen is very dense, it's not going to allow me to put filler in, okay? I can't really, I was going to draw something, but I can't draw density, so it's hard to draw dense skin. But the point is that we use this pump to aid and help us increase ultimately the size of the penile shaft and partially the glands as well, in regarding skin that forms dense collagen after permanent filler treatment. Okay, so there's your third reason to use it. Now there might be other reasons. Doctors may use it to heal some things, maybe put oxygen in there and do some fancy things. But for our intents and purposes, in the field of male enhancement, erectile dysfunction, which it is primarily used for, the penis pump is placed on, you put a little Vaseline at the base, you pump it up. If you're using it for erectile dysfunction, where you need blood to come into the penis for a normal erection, that takes about a minute or 2. Then you put a band at the base, and hopefully that'll be okay. The other reason is you just want to be bigger in general, so you leave it on a little longer, do it carefully. I instruct my patients a certain way. Okay, so you have to consult your doctor or find that information. But for my patients, I tell them to incrementally, slowly increase the pressure over time. In addition to the pressure over time plus the amount of time that you're in that chamber. Okay, so figure within a let's say 4-week period, you'll be at a 7 millimeter mercury pressure, and you'll be in there about 45 minutes to get your desired results. Now, if you just want to be an inch bigger in girth, it might only take 25 minutes. But if you want to go 2 inches, it might take 45 minutes and so forth. Okay, so that's up to you and what your desired goals are. You can get more information, probably my website. It's lauriamedical.com. If you want to give us a call, we can discuss it. I have consultants on staff that help me with this. So if you do have questions about it, we can certainly chat about it. There are a lot of good companies out there that sell this product. So if it's something of interest, you just do a simple search and you'll be able to find it.